Hello, and thank you for joining this live, toll-free town hall meeting with your Congressman Randy Weber. Tonight, you'll have the opportunity to hear from Congressman Weber and other government officials regarding the latest updates on the coronavirus response. On the line, we have local representatives from the Small Business Administration, the Texas Department of State Health Services, the Galveston County Health Departments, Texas Department of Emergency Management, the Texas Workforce Commission, and the Independent Bankers Association of Texas. They're all here ready to answer your questions. Before we begin, a few quick reminders. If you'd like to ask a question of Congressman Weber or any of our guests, you can do so at any time by pressing *3 on your telephone keypad. Again, press *3. You'll still be able to listen to the call, but you'll be placed into a queue, and we're going to try to get to as many questions tonight as we can. Got a lot of folks on the line, a lot of good information to cover. So again, at any time, if you have a question that you'd like to ask, you can press *3 on your telephone. And as folks jump on this call, we'll be making that reminder often. With that, I'm going to turn it over to your Congressman, Randy Weber. Congressman?
Well, thank you, Jason, and friends. Thank you all for all who are joining the call tonight. And I want to echo what Jason said as a reminder. If you have a question, please press *3 to be entered into the queue. Now, I also want to take this time to encourage y'all to subscribe to our e-newsletter at weber.house.gov for the latest updates on the coronavirus response and for the latest up-to-date resources, quite frankly. So, again, that's weber.house.gov. As you know, there are many, many components to the coronavirus response. Last week, Congress passed the Payroll Protection Program and Healthcare Enhancement Act to provide an additional $321 billion with a B dollars in funding to the PPP, Payment Protection Program. That funding was necessary to sustain small businesses and protect those jobs. This legislation, for those who might be wondering, excuse me, also includes $50 billion with a B dollars for the Disaster Loans Program, as well as an additional $10 billion for the Economic Injury Disaster Loan, or EIDL, grant, and $75 billion to support hospitals, and $25 billion to expand testing efforts. Now, folks, we've been spending a lot of money. While I have serious concerns with the massive amount of spending that bears absolutely no offset, has all the relevant budgetary controls waived, I realize the overarching and overriding need to stabilize our citizens and our economy, especially our businesses, of course. As of 3:30 p.m. Eastern Time yesterday, the Small Business Administration announced that they had processed over 100,000 PPP loans from more than 4,000 lenders since the program resumed accepting applications. Give you kind of a feel for how fast it's going. The administration has also said that the more than $2 billion in loans that were declined or returned in the first round of the PPP funding will be made available during the current application period. So that's good news. Factoring in the numbers from yesterday afternoon, the program has now approved loans for more than 1.7 million small businesses since it was initially passed by Congress. Even more important than this much-needed relief, Americans need their leaders to find the quickest path to reopening our economy. America needs and wants to get back to work. And let me just tell you, Congress needs to lead the way. Speaking of getting back to work, many of you know, Governor Abbott announced his plans to reopen the Texas economy, which I applaud. I'm happy to report that Texas has seen sustained improvement in its statewide COVID-19 data, a declining infection rate for the last 17 days. Our hospitalization rate is steady, and hospital capacity statewide remains abundant. As such, the governor's statewide stay-at-home order will expire on April the 30th, 2020, as planned. The sooner Texas is able to fully reopen, the less time it's going to take us to recover, folks. I understand that during this transaction, there's still much need for financial relief, and many of you still have questions regarding the potential spread of COVID-19. So, tonight on the line with our Teletown Hall to answer all of your questions as quickly as we can get to them, we have some subject experts, some really good folks that have been helping us throughout this process. We have Mr. Sushil Kumar, who's a public information officer for the U.S. Small Business Administration. We also have Blair Walsh, who's the section chief for Texas Division of Emergency Management. We have Mr. Sean Miller, assistant chief, Texas Division of Emergency Management. Ms. Christy Hester, director of growth and development of Independent Bankers Association of Texas. And we have Ed Cerna, Texas Workforce Commission Executive Director, and Dr. Kaiser, who is our local health authority from Galveston County. We thank them for all the help they've been giving us and for all they're continuing to do to keep us safe and to get Texas back on track. A quick reminder, if you would like to ask a question and you joined us late, please press *3 and you will be entered into the queue. Given the time constraints of the call, if we do not get to your call while we're live, my staff is recording all the questions and will follow up with you directly. Your feedback is absolutely essential to us to making the right decisions in Washington. As your elected official, it is my responsibility to protect our citizens, neighbors, and communities, and I cannot do that without your input. So, thank you for your participation. And with that, Jason, I'm glad to be here. Glad we've got many callers on the line. I'm going to give it back to you.
We appreciate that, Congressman. Again, just a reminder, if at any time you have a question, please press *3 on your telephone, and we're going to get to as many folks as we can. And we're going to just jump right into it. We have our first caller on the line, which I believe is A.B. Bernard from Beaumont. A.B., are you on?
I'm here.
Go ahead, sir.
Congressman Weber.
Yes.
Yes. My question is that the president and vice president last week set out some guidelines on when they recommend that things open up in our economy, and that time frame is approximately 3 weeks from now. But you just said that you support Governor Abbott's opening up early, and there's a conflict there, and there's a misunderstanding between following what the president put out, and what Governor Abbott and your support. Without putting a spin on it, why are we having this confusion throughout the United States when the president already set the guidelines, even though in later press release, he's for opening it out sooner than the medical professionals that works with him and worked with our vice president set the guidelines, and we're ahead of ourselves. And you yourself said that you support it. So what is without a spin on it? Why are we doing this?
That's a very, very good question, Mr. Bernard. And I've been watching this closely for the last 2 or 3 weeks, and really more than that, but it's been on so many teleconferences with CDC, with the White House, with those doctors you're talking about, with the experts. And let me just say this: this is a very, very fluid situation. There's 50 states. Not all 50 states are in the same boat, if you will. I think the president is coming to realize that when he's made those comments 1 or 2 weeks back, him and the vice president, that there are pockets of there's some really bad pockets, as you know. New York, parts of New Orleans were some of those, but in Texas, not necessarily so. And I'm going to wax a little philosophical for just a minute. It's a true case of federalism, where you've got a federal government and you've got local states, 50 of them, that have rights as well. And those governors you can see this all across the country, have different opinions on about what they need to do in their particular state. Now, having said that, all in all, I think Governor Abbott is listening to the medical professionals here in Texas. And let me say about Dr. Fauci and some of the others on the national scene, that they are medical experts, epidemiologists, some of them, and they're trying to give to us the absolute best way to prevent the spread of the disease from a medical standpoint. I get that. I absolutely get that. But on the other hand, you've got the governors of states who are looking at their economy, looking at their economy experts, their medical experts in those pockets, 50 pockets we call states, and they're saying, you know, I think in Texas that this can happen, that it can be done this way. So without going into a lot of the other details I've heard on conference calls, I think that's what you're saying. The individual states are making their own calls. The president would love to see things happen, but as we've progressed here in Texas and we've gone down 17 days in a row on our cases growing, if I remember correctly, I think you're seeing Governor Abbott react to that and saying, and quite frankly, Mr. Bernard, he's hearing people say, you know, I need to go back to work. My business needs to go. I need to get my job back. I've got house notes to pay and things like that. We think we can do it safely, and I think that's the mindset the governor's operating under. I hope that wasn't too lengthy, and I appreciate your call. Jason?
Okay, thank you for that call. Again, if you have a question that you'd like to ask Congressman Weber or any of our panelists, please press *3 on your telephone, and we'll get to as many as we can. We're going to move right along with our next caller, who is, let's see, we got Kenneth Crane from Lake Jackson on the line. Kenneth?
Good evening, Congressman.
Good evening.
I've been under some strange circumstances, losing my job and having to depend on Social Security to live, going from a 6-digit figure income to $2,000 a month is a drastic, life-changing impact on my financial situation. But I was wondering, in all this that I've heard about stimulus, there's been no mention about anything for anyone on Social Security or disability. Is there anything that's coming up that might benefit us?
Well, that's a good question. And as I said earlier, we've got some great subject matter experts on the phone. We've got the gentleman, Mr. Kumar from SBA, who actually he knows, he's been very knowledgeable about a lot of the different agencies, even though he's not with Social Security or with that part. Mr. Kumar, are you on the phone with us? Can you answer his question?
I am, sir, and I have no visibility. Thanks for the compliment, Congressman. I have no visibility on the Social Security side, unfortunately, but I could take it up the food chain and see if there is any and get back to you, sir.
Well, we can do that. We can jump over to Miss Christy Hester with the Bankers Association, and she knows a lot. She's been through a lot, and she's been a great stalwart of ours. Christy, you have any experience there?
I do know that the stimulus check available for Social Security, I don't know of any ongoing type programs, but the stimulus checks were sent out to those on Social Security.
Right. It may be, Mr. Crane, that we can take your number and we can get back to you. As we said earlier, you know, tell people press *3 to get put into the question queue, but we're not going to be able to get to everybody. There's so many in the limited time. But we will record these questions and we will reach back out, or you could go to your office. I work for you. It's your office, weber.house.gov, and contact us, and we can get that question for you.
Congressman, this is Christy again. Don't we have someone from the unemployment office? He did mention he lost his job. I'm just curious if there was something on that side.
Well, that's a good question, Christy. Mr. Cern, are you on the line with us?
Yes, sir, I absolutely am, and I was kind of patiently waiting my turn. There are opportunities for individuals who are retired, who have lost their job, whether they are self-employed, contract employees, or they were working for someone else, to apply for benefits. The CARES Act, signed by the President back at the end of March, added the self-employed and the contract employees, the 1099 employees, as well as employees of nonprofits to the mix. The best way to do it is to go online. There's a benefit estimator that we have on our website, twc.texas.gov. or you can apply for a benefit, apply for claims or submit your claim benefit. It's the same form whether you are self-employed or a 1099 employee or whether you are a W-2 employee. It's the same form. Get that in online, and then we'll certainly evaluate the situation and determine if you are qualified for benefits either through normal unemployment insurance or through the CARES Act.
Does that help get your question answered, Mr. Crane? That's good advice, good information.
I think he's off the line. Yep.
Okay. Well, we appreciate that.
But that's
question.
okay.
That's helpful. Go ahead, Jason. Back to you.
Okay, great. And we're going to try on follow-up questions to get to as many as we can. But we're going to move over to our next caller, Bubba Russo, who's calling from Santa Fe. Bubba, are you on?
Yes, I'm here.
Go ahead, sir.
Yes, sir. Yeah, no, my question was directed at the application process for the SBA was one of them. My parents, my dad was Jerome Russo. He's a constable here in Santa Fe, and my mom told me I needed to talk to them about assistance. And of course, because I own a company and I moved from Austin down to Santa Fe, and they when I processed it on March 20th, it was a very long application. I submitted all the documentation. You know, my CPA had just given me my information for the year, transcripts, everything, and I never heard from anybody. Then when I finally, so you wait on hold for a long period of time. I understand there's a lot of people in distress and a lot of people that have questions with the SBA, but the process in getting through, when you finally get there an hour and 45 minutes later, they don't have an answer for you. And after about 3 calls, after a couple of weeks, finally talked to an individual who sent me a shorter form, and I sent in the shorter form. That was great. That was for the idle loan, and he told me I would have $10,000 in 3 days, which was incorrect information yet again, because it was actually after you talked to a loan officer. Well, I still have never talked to a loan officer. I've never heard from anybody, and I filled out another application. I know they checked my personal credit. They did a credit check on me. They did send me, I guess, $2,000 on the 20th, so it was a week ago. I was thankful for that, but I have never heard from anybody about any kind of other assistance to take me to the next level to survive. And I'm still waiting. They send a little bit of money, but I haven't heard from anybody else. So I don't know what else to do. Do I need to fill out the loan application again because of the new money that's coming through? Or am I still in line with the application that I've already submitted 3 times, 3 different applications?
That's a great question, Mr. Russo. And
Congressman, would you like me to take that?
Yeah, if you don't mind, go ahead.
Not at all. Mr. Russo, thank you for your patience. There's a bit of static in the background. Can you hear me?
Yes, I can. I've got it on a headset. I can take it off the headset. 1 second. Let me just make 1 second.
Thank you, sir.
Okay. Is that better?
Much better. Much appreciated, sir. Again, on behalf of the SBA, my most profound regrets for the steps you've had to take to get to the place where you're getting your advance. I'm glad you got your advance. Let me focus on the positive and then offer some bit of context as more of a solace rather than anything else. You've gotten your money on the 20th, which means in the next couple of days you should be getting an email from us from a .gov domain that'll ask you to open an account on our portal, inside of which you'll see loan documents and any other germane material regarding your very specific case. So you are in that sweet spot. Now, looking back in hindsight, from the 20th of March, which is approximately when the state of Texas was declared by SBA Administrator Carranza, and the 30th of March, there was one process that was in place, which you went through. The SBA and Secretary Mnuchin and what have you got together and decided they wanted to do something far more streamlined for the benefits of the many. They streamlined, suspended, made better, a lot of different things to make it easier. And from the 30th of March through now, we have funded quite a bit of money out in the form of advances and working capital loans. As a matter of fact, ironically enough, during the lapse in appropriations, we had more Texans, Louisianians, Arkansas, and Oklahomans, I cover those 4 areas, and Southern California, that got their money. I was talking to Christy quite often this past week saying, hey, they got their money. What do they do next? Same scenarios took place. So apologize for the wait that you had to go through. Give it a couple more days before they get it in terms of the link to the website portal. I know you have your phone number, 1-800-659-2955. And again, much appreciate what you do for the economy. And stand by. And if you have any other further questions, the Congressman's office has my email and phone number handy. I've helped many of his constituents, and I look forward to assisting you also. And I appreciate you.
Well, thank you for that, Mr. Kumar. Ms. Russo, let me just add that I've been your representative over here. I know you moved into Santa Fe recently, but I've been in office. This is my 8th year. I've never seen this kind of thing in my 66 years on planet Earth, and the kind of response that your federal government has come out with in terms of addressing this situation. I hear this all the time. The SBA has in 14 days done as much loan applications and stuff as they usually do in about 14 years. So you can imagine the back up and all of it. They've hired more people. They've worked as fast and furiously as they can. But you can just imagine the amount of strain and stress that is put on the system. But they're doing everything they can. I don't think I was listening to Mr. Kumar for a little bit, and I don't think you want to apply again because I don't think you want to jump back in that queue. I think if you wait, he's right. That's right, and he's right, and your money will come in. We appreciate your patience, and these are the kinds of stories that help us all to understand that it takes time. There is a lot going on in terms of trying to get to everybody as quickly as can, and we just appreciate people's patience. So thank you for your call, Ms. Russo. I hope you get the rest of your funding pretty quick.
Congressman Weber?
Yes, sir.
I have a quick announcement to make. I got a press release that came from Secretary Mnuchin and Administrator Carranza. Perhaps I could read it real time to the audience and everyone else here.
Yes, sir. Go ahead.
We have noted the large number of companies that have appropriately reevaluated their need for PPP loans and promptly repaid loan funds in response to SBA guidance, reminding all borrowers of an important certification required to obtain a PPP loan. To further ensure PPP loans are limited to eligible borrowers, the SBA has decided, in consultation with the Department of Treasury, that it will review all loans in excess of $2 million, in addition to other loans as appropriate, following the lender's submission of the borrower's loan forgiveness application. Regulatory guidance implementing this procedure will be forthcoming. We remain fully committed to ensuring that America's workers and small business get the resources they need to get through this challenging time. I just wanted to make sure that I'm sure you're aware, you're in the know, but the rest of the folks who are in the audience were aware of this real-time and press release that just came out.
No, that's a great point, Mr. Kumar. Thank you for reading that. I sure appreciate that. Jason, I'm going to kick it back to you.
You got it. We're going to take our next caller, Bill Stark from League City. Bill, are you on the line?
Yes, sir, I am. Good evening, Congressman Weber. How are you, Randy?
Well, hello there, Mr. Bill. I'm doing well. You doing okay?
Any better, and I'd be identical twins. First of all, I just want to say that we're fortunate to have you as our congressman in our district. The only thing I have to add is I would just make sure that you've got your eyes on what's going on when they reopen this thing. I've got a lot of faith and confidence in you, and I know you'll do the right thing, and I just want your assurances that you're going to keep an eye on us and through all this.
Well, thank you for saying that, Bill. I sure appreciate that. And yes, as I stated earlier, I don't know how long you've been on the call, but I've been on so many conference calls with the CDC, with doctors, with the state officials, emergency folks. We've got emergency people. You know, we got Blair Walsh, Section Chief, Texan Division of Emergency Management, on with us tonight. We have been been on with the governor, been on with the Harris County elected official, been on with the mayor of Houston, been on every single call I can, Bill. And yes, we're watching this very, very closely. As you know, me and my beautiful bride, grew up in this area. She on Jefferson County, me over in Missouri County area. So we're watching it. We want our businesses to get back. We want to do it thoughtfully. We want to do it correctly. We want to do it carefully. And I think you're going to see that. So I appreciate the kind words. Thanks, Bill. And Jason, I'm back to you.
You got it. And, of course, if you have a question, we still have a few more folks jumping on the line. Just one more reminder, if you have a question, you can press *3 on your telephone keypad, and you'll be placed in the queue. Our next caller is Lloyd Coleman, who's calling in from Galveston. Lloyd, are you on?
Yeah, I'm here.
Go ahead, sir.
How you doing, Ms. Rand? I appreciate your representation. I have a question about
Good.
the Texas Workforce Commission.
Yes.
We've been trying to get on for employment benefits, but the line's always busy. Then I go online and it says you already made a request for payment. And so I'm trying to call, and I've got two different numbers, and both lines are busy. So I'm confused on what I should do.
All right. Well, this is where Mr. Kumar gives us. Is it the 855 number, Mr. Kumar?
It's the 800-659-2955. That's for the SBA. I think it's referring to EDD or the employment, correct?
That's right.
The Texas Workforce Commission, the number that I get for employment.
Right.
That's the number I've been dialing. It's an 866 number.
Mr. Cerna, how about helping us?
Yes, sir, absolutely. First of all, I apologize that you are having as much trouble getting in as is everybody else. It seems like no matter what we do, the call volume continues to increase. We have not seen a downward trend at all. If you will send your contact information, first of all, let me say, if you will send your contact information to the congressman's office, they'll get it over to me, and I'll get that looked into, get that addressed. But the short answer to your question is you should already be set with everything that you need. But if it is saying that you've already requested payment and you have not, I need to make sure that there's not something else going on. We are fending off a whole lot of people that are trying to commit fraud and do other things like that. Unfortunately, when our neighbors, our fellow Texans, need help, there's also people out there that are trying to take advantage of that situation. We have added telephone lines. We have added people to answer the phone. We are up to close to 1,200, 1,400 people that are answering the phone, but we're still getting inundated with calls. I think every day on average we're probably getting anywhere from 700 to 800,000 phone calls. Now we can't answer all of those. It's just physically impossible.
Well, they gave me a
day.
We
will get that addressed.
I want to interrupt you. They told me to call on Mondays, and so I call on Mondays, but then it's busy, and I guess that's my day to call. It's Mondays.
Yes, sir. But let me also talk about that. We do ask people when they call to request payment that they call on a specific day of the week: Sunday, Monday, Tuesday, or Wednesday. If you can't get in on your day, Thursday, Friday, and Saturday are open days and are available to anybody. So you can try on Thursday, Friday, or Saturday. It's an open day. If you couldn't get through on your designated day. But again, if you don't mind sending your contact information to the congressman's office, and they'll get it to me, and I will get that looked into immediately.
Well, thank you for that, Mr. Cerna. And by the way, Mr. Mr. Coleman, right? You can call our office at 281-316-0231 in League City, and they'll give you an email address, and we can help you with any way we can. So we appreciate that call, Jason.
Okay, that's a good question. I believe we're going to take a few questions from folks who are asking about, I think, the status of, I believe, the shutdown and the virus itself. We have Eva Meeks from Clute who's on the line. Eva, are you there?
Yes, sir.
Go ahead with your question.
Okay, my question is, statistically, so far, they're saying that people that are dying are very old or immune compromised. So it seems like it would make more sense to have a stimulus package for those people so that they can stay quarantined in their homes safely while the rest of us run this country. Why are we destroying our country when it's not necessary?
Eva, thank you for that call. That is the subject of discussion that we've had on numerous conference calls, basically protecting the vulnerable. We're getting input, as you know, from a lot of our medical people. Indeed, we've got Dr. Kaiser from Galveston County Local Health Authority here with us about how this can be spread so, right word's not nonchalantly, but so easily. It's so contagious, and so we don't want people taking. I think that was our initial tack. They don't want, schools were closed. You don't want kids giving it to their parents, giving it to their grandparents. And I think people are beginning to get their arms around the Texans, especially in this state. I said earlier that 50 governors get to make calls for 50 different states. And we're beginning to see that maybe we've got a little bit better way that we can do this thoughtfully, carefully, and we can actually open up the economy. So what you're saying is hitting at the heart of the discussion that's been going on in the White House, in Austin, Texas, in our 3 counties of District 14. And I think you're going to see we're going to begin to open up and count on Texans to do the right thing. Now, there's a note of caution here, too, and that is if we start I said earlier we've had a decrease in the last 17 days, I think it is. If we start to see an increase in cases once we open back up, we'll reevaluate. But rest assured, your elected officials from the White House to the Capitol in Austin, right here to your congressman in District 14, we are paying very close attention to this, getting as much data as we can, as much input as we can. We're having discussion with, believe it or not, governors of other states, other members of Congress throughout the country, and we're trying to pick the absolute best, safest way to do this in Texas. And I think you're going to be pleased because I think we're on that road now. Thank you for that question. Jason, I better give it back to you.
Okay. Our next caller is Freddie Voorhees from Port Arthur. Freddie, are you on? Freddie? Okay. Must have dropped off. We're going to take it over we're going to stay in Port Arthur over to Rosa Allen. Rosa, are you on the line?
Yes, I am.
Go ahead with your question, ma'am.
I was just wondering why it have not been mandatory that everyone, residents in Texas, wear masks.
Well, thank you, Miss Allen, for being on the line with us for that question. I think you're seeing in the governor of Texas be very, very cautious about taking that approach. They were in short supply, as you're probably well aware of, early on, and they wanted the most vulnerable amongst us to be able to get those masks and those in the healthcare profession. Dr. Kaiser, you're on the line with us. Did y'all find it difficult? He's Galveston County Local Health Authority. Did y'all find it difficult to get personal protection equipment, Dr. Kaiser?
Oh, almost certainly. I mean, in the beginning, there was one point where we had 11 days worth of PPE, and that was all we had, and we were very frightened that if we ran out of that, that we wouldn't have anything to protect ourselves in taking care of sick people. That's changed. The supplies have opened up. Things are very good, and I understand that people have very strong feelings about masks, one way or the other. And I would just like to reframe it a little bit rather than, issues of making requirements or constitutionality. I think it's individual respect and doing unto others as we would have done unto ourselves. And so when I go out, I wear a mask, and we would encourage people to wear masks. And you don't necessarily need to wear a surgical mask. There's lots of ways that you can make masks out of cloth, and there are all sorts of very creative ways on the internet. But the more we wear masks, particularly as we start to open up the economy, and I think that's a very important thing to do, the less likely we will be to spread it to other people. And the real concern isn't so much that keeping the elderly and sick people locked up. Our real concern is that, healthy people can get it and then they take it home. And you don't want to take it home to your parents or grandparents or your sick husband or people like that, because those are the ones who are going to suffer. So if everyone would wear a mask and everyone just be respectful of everything else, I think we'll be okay.
Well, thank you for that, Doctor. And Blair Walsh, you're on the line with us, Texas Division of Emergency Management. So y'all were kind of on the front end of seeing the shortage. Can you give us a little background on how that played out?
Yes, sir. So early on in the event, we began supplying PPE to locals. The supply chain was definitely scarce. I think we still see some scarcities on supplies, but the governor stepped in and created a strike force for the state and brought in 2 experts from companies here in Texas and began putting together a team to go out and procure this PPE. And so we have been buying millions of masks, gowns, gloves, and working really hard as a state to be able to provide for our medical professionals, EMS, fire, first responders, police, so that they are able to have the needed PPE. I think we are seeing now that the PPE is flowing to those local jurisdictions, and we are continuing to purchase it. As different areas of the world are responding to coronavirus, we're seeing the supply chains take hits in different ways. So we are working really hard to stay on top of that, to have what is needed around the state. And as was mentioned earlier, we did have locals that, early on were looking at very limited number of days of PPE, and the state set up a plan to mobilize 8 different regions in the state to have distribution points for those locals. So that we could get out as quickly as possible. Today, when we receive in a shipment, it's usually picked overnight, so people are putting together what is needed in the jurisdictions and pushed out the next morning. So I'm very happy to hear, especially from Galveston, that they are finding that the PPE is flowing a little freer. We definitely feel like we are catching up to that demand. We're not there yet, but we're continuing to purchase, and we'll continue to try to meet those needs as much as possible.
Well, thank you for that. I knew you figured you'd have that background. As I said earlier, the government has been really good in this, in my opinion, in most of this instance, and that is trying to catch up as quickly as possible and trying to make sure that not only did the money flow, but the PPE, personal protection equipment, flowed as well. And so we really appreciate Texas and what the governor's been doing, what y'all been doing, quite frankly. So I think that's a long answer to a question about why haven't we mandated everybody wear masks. I do want to remind people, if they have a question that they would like to ask, press *3 to be put into the queue. And with that, Jason, I'll hand it back to you.
You got it. We have a lot of great questions. In fact, we have Steve Grove on the line from League City, who I believe has a question about mortgages. Might be helpful to kick this one over to Ms. Hester, Congressman. But Steve, are you on?
Yes, sir, I am here.
Go ahead, sir.
Okay, good evening. Several of us, and I'm not the only one, I've been talking to several friends, are having real difficulty with our mortgage companies not wanting to do forbearance, and what they're saying is that they simply want to defer payments for 3 months and hit us with a balloon payment for all of our payment in 3 months, rather than allowing us to delay our payments, or whatever the grammatical term is, forbearance or whatever, and then put our loan payments on the end of our loans. From what I understand, that was part of the CARES Act, and several of the mortgage companies are refusing to abide by that.
Christy, what's been your experience in that regard?
Well, I don't know of any specific that to a program. Obviously, there was some guidance that came out from the regulatory agencies that indicated that they recommended working with borrowers and, helping out folks on their mortgages or other types of loans. And then regulatory agencies have made some certifications to the banks that they will not be, those loans, if they are given a deferral or skip a payment, the banks, those won't be considered troubled assets. So there has been some information that's come out about it for sure, but I don't know of any specific program that came out of CARES. But what I would tell you is that obviously each bank will have different types of mortgages. Mortgages that are sold into the secondary market and have investors involved are going to have one set of rules. A local smaller lender should be able to make a request whereby you do move those payments to the end of the loan. However, there are things such as home equity law in Texas that could affect that, depending on whether you have an escrow account and how your mortgage is structured. There is a lot of complexity in the mortgage loan, so I can't describe your particular scenario and as to why your lender would be telling you that. And I would just recommend that you give them a call back and talk with your lender again to see if there's some other way that they can help you with. That would be some type of modification. There's a difference between a modification and a deferral. A deferral is the process you described. A modification is something that would allow you to either spread those payments out or to add them to the end of the note and change the maturity date on your loan. Again, don't know your lender, don't know the exact circumstances, but hopefully you can visit with your lender again and get some relief in that manner.
Well, thank you for that, Christy. And Steve, I hope that helps you. You can call our office and see what was in the CARES Act. She made mention of the CARES Act, and see if there was language in there that prevented mortgage companies from doing those kinds of things. We can do that research for you if you'll call your office. As I tell people, our office here in Galveston County in League City is 281-316-0231, and thank you for calling in. And with that, Jason, I better give it back to you.
You bet. A lot of calls coming in now. I think the next caller on the line here is Kyle Stogner. I'm not sure where Kyle's League City, calling from League City. Question about I think the oil and gas industry. Go ahead, Kyle.
Afternoon, all. Actually, I'm calling you from Methodist Clear Lake in the ICU unit. I had a collapsed lung this morning. But anyway, I appreciate y'all reaching out, and the questions and answers have been very, very helpful. My question was, I'm a small business owner, me and my brother, and we own a supply house in the oil and gas industry. We were doing pretty good at 50 and then down to 32, but when the oil industry really tanked, you foresee that coming back anytime quicker. And basically the second question I had, I think, was already answered. I can now file for unemployment through the act that Trump had signed. Is that correct? And thank y'all.
Yeah, that's correct, Kyle. My understanding. Now, let me answer your question about the oil industry coming back. One of the I mentioned earlier that I've been on so many conference calls. One of them was the HEAT team, which is called the House Energy Action Team, where we're so concerned, especially in Texas, about the energy industry, and you're watching it. You're watching the war going between Russia and the Saudis over the price of a barrel of oil, and you're watching Texas producers. You're actually watching the whole industry suffer from that. And I've been in contact with the White House. I'm a good friend with the President's Chief of Staff, Mark Meadows, and I think the President ought to take some steps. He did it with China when they were cheating on steel and other metals and stuff, dumping steel. I think we ought to think about taking some steps against the Saudis, Russians. We probably don't buy much oil from, but making sure that we keep our producers able to compete. We want to get production of oil. We want to build up our Strategic Petroleum Reserve, our SPR, which you may or may not know is about 60% of it is housed here on the Gulf Coast of Texas. And so there's things that we're talking to the White House about doing, things that we're talking to some of the energy experts about doing. We'll be in consultation with some of the refiners because it will directly impact some of the refineries in our district and around the country, really. But we're very, very mindful of that, and we're wanting our energy industry to remain strong and come back as quickly as we can. Sorry to hear about your lungs. I hope that comes out for you okay. And anyway, we appreciate the questions, and I hope that helps, Kyle. And thanks for being on. Jason, I'll kick it back to you.
You got it. Just one last reminder, if you have a question and you'd like to ask the congressman or any one of our panelists, you can press *3 on your telephone keypad. Okay, we're going to move it over to Kathy Frederickson in Galveston. I think she had a good question that maybe Dr. Kaiser or some of our folks with the Emergency Management Division might be able to help with. Kathy, are you on?
Yes, I am.
Go ahead.
And thank you all so much for all of your tremendous efforts serving us so well, and thank you, Randy and Brenda, for being there tirelessly working to help us stay well. We appreciate it. My question is there the serological finger prick stick test for antibodies available in Galveston County? Can we find a place to go get that? We feel we may have the antibodies, and we would love to help others if we have that available, and listen to Dr. Bhattacharya's from Santa Clara County in California doing such a great job in testing their county, and could we bring it to Galveston County and help with the hard data that will help us help you all make great decisions for health and well-being for all of us?
Well, this is a great question, Kathy. Thanks for asking. And Dr. Kaiser, you on the line?
No, that is a great question, and I'm being very honest when I say we're working on it. That's not a bureaucratic put-off. We really are having a lot of discussions and looking at ways to get antibody testing stood up around the county. I would say look for it in about 2 to 3 weeks. There are lots of technical issues in getting it set up, as well as issues in how to interpret it. And there's so many tests out there. We want to make sure that we get the right ones and we're getting everybody the right information. The second thing I would also just let everybody know is that we're looking at setting up more testing sites across the county when we hope to have at least 2 more drive-through testing sites by next week. And so, we're pushing very, very hard to get as many people tested. We're actually very much ahead of the game, thanks in large part to UTMB. We've done almost 15,000 tests in the county, which is about 5% of our population, and that puts us way ahead of the country as a whole. And so we're very happy that we've been able to do that, and we'll continue to try and roll out the new technology as quickly as we can.
Well, thank you for that, Dr. Kaiser. And we've got Sean Miller on the phone with us, on the line with us, Assistant Chief, Texas Division of Emergency Management. Mr. Miller, is that the kind of thing y'all been watching and tracking and working toward?
Yes, sir. So what we've been looking at is we're starting a new initiative with the Texas National Guard and the state in providing some additional mobile testing sites, which was alluded to throughout Texas, not only in the rural areas, but also in those areas that are very underserved. They may not have the ability to go to a local hospital or a nearby doctor's office. So we started that early this past week. We continue to roll it out, and we'll be continuing to roll that out for the next 15 days, and with obviously always the potential to do more. We did Brazoria County on Friday in Pearland at the Pearland Junior High School. Got about 100 Texans to come through. We're actually looking to come back through the area very soon with sites opening up on May the 5th in Beaumont at the old number 1 fire station off of College Street from 9 a.m. to 6 p.m. And then also on May 6th, again, we'll also be opening up some additional sites in both Brazoria and Galveston, where both of these sites will have 2 testing lanes, and that'll provide us the ability to test approximately 200 Texans that come through to those collection sites. So we're ramping it up, helping provide more opportunities for testing so we can get the data and help Texans know where they're at during this pandemic.
Well, thank you for that, Mr. Miller. And that points out exactly what I said earlier about, the federal government's working, Texas is working, the governor's been working, our great emergency management folks have been working, Mr. Kumar with the SBA here, Christy with the Bankers Group, and this is a concerted effort, folks. And you're seeing that, and the lady that called in about asking shouldn't masks be mandated, and the gentleman who said, are we trying to open up too soon because this is a disagreement between Abbott and Trump. I say your Texas, what you're going to call it, government hierarchy or whatever, is on the job. You're hearing from the experts, and we're doing the best, the quickest, the safest that we can. So hopefully y'all be encouraged. That's my 2 cents about that, but I'll give it back to you, Jason.
You got it. A lot of good questions here. We're going to kick it over now to Matthew Payne, who's calling from West Columbia. I think he has a question a lot of folks have been asking. Matthew, you on?
Yes, sir, I'm on. Congressman Weber, thank you for doing these town halls. I find them informative and helpful, even if all the questions don't pertain to me or are not questions that I have. The information is helpful, so thank you for that. My question is this, and I'm going to refer you to a YouTube video put out by Dr. Erickson and his partner, who are emergency room physicians. And they ask a basic fundamental question of, why are we sitting there closing down the country to 6 to 8 weeks, basically for a virus that's no worse than the flu virus? You know, we've talked about, I don't want to spread it. You know, they have taken actual data as frontline emergency room physicians over the last 2 months, plus the world data, plus their contacts all over the world. The mortality rate for this is 0.015%. You're 5 to 10 times more likely to die from the flu. It's also interesting when he mentions the fact that Dr. Fauci, who published in the New England Journal of Medicine, and I'm quoting here, this is no worse than the influenza viruses that go around every year, okay? When the flu comes around, we don't test people feverishly for it. We don't close off the country. We don't quarantine healthy people. We let everybody move around about their business. Now, part of that is because it's just literally impossible to sit there and contain something like this. This is not Ebola. It's not anywhere near something like Ebola, okay? And I know that because part of that is because my daughter was in the Ebola thing in Dallas, in her healthcare profession. This is not remotely like this, okay? We have people, having masks. They talk about masks. The minute you touch that mask, you've just infected yourself, okay? You can't truly quarantine because you need people like firemen, policemen, mechanics, all kinds of support people to take care of things when things don't go well, when people die from other things. And there's a lot of other diseases that people die from, okay?
Yeah, let me jump in there, Mr. Payne, if I may, because I think I kind of got the idea. And we hear that, and I don't know how long you've been on the call, but I've been on more conference calls with more CDC, White House, Dr. Fauci, and others, right on down the list. And we've got Dr. Kaiser of Galveston County Health Authority on today. But I think just from and I've lived in the 20-mile radius 66 years. What is it, 9 months now? In 3 months, it'll be 67 years. And I've never seen anything like this. But I have to say, Mr. Payne, watching this evolve as it has, it's been out of an abundance of caution on many, many fronts. But as far as the actual virus itself versus the flu, I'm going to hand that off to Dr. Kaiser. Dr. Kaiser, give us your opinion about that comparison, would you please, Doctor?
Sure. With all due respect, I think that's not correct. I really, this is actually much worse than the flu. And let's step back and put things in perspective. We've had almost 60,000 Americans die since January 20th. We've never had that with the flu. Not since 1918 anyway, not in 100 years. If people like to do comparisons of numbers of deaths and things, but, keep in mind, 58,000 Americans died in the Vietnam War, over the whole war. 30,000 Americans die in car accidents every year. This really is truly different. And we have been very fortunate in Texas, both from the fact that we're in the middle of the country and it took longer to get here, and we don't have as big a population density as, say, as New York City. And our leadership took action at the appropriate time to keep it from spreading like wildfire. And so we're in a position now where we're seeing our cases decline. We're seeing our rates go down. And I think the social distancing has worked. And I think it's now time to start loosening up and making sure that we do it in an orderly fashion. But if you lived in New York City, where literally they're stacking bodies up inside refrigerated trucks, I think you might have a little different point of view on that. And so, I know a lot of people don't think that it's a big deal because I don't think we've really seen the effects. But this really has been a big deal, and I think our government here has acted very responsibly.
Well, thank you for that, Doctor. Mr. Payne, I may add just by way of ending, at least on this question, that I said earlier, we're going to open up the state as safely and quickly and efficiently as we can with a lot of data input. And the good doctor just referred to a lot of data, in fact. And I know there's data from the other doctors who don't have that same opinion, and that's what part of the things that makes our country great. But rest assured, your elected officials are doing everything they can to look at this from every single side, every single aspect. So I appreciate that call. That's a very valid question. And with that, Jason, I'm going to hand it back to you.
You got it. And folks, again, if you are unable to get your question into Congressman Weber or our panel, we are taking notes on all the questions that you've asked us for. We're going to make sure we try to follow up with everyone and answer as many questions as we can. We're going to go now to Libby, and I'm going to apologize in advance for butchering this. Libby Sladaritz, who's calling from over in Beaumont. Libby, are you on?
I am.
Go ahead, ma'am.
Okay.
Welcome, Libby.
Welcome. Well, I met you 6 years ago. We took a 4-H rocket team that qualified for the Nationals in Virginia, and you came to their breakfast and met and visited with them and took pictures with them. And when people would ask them what was the neatest thing, you were either the first or the second thing they would say. We got to meet our representative. He actually came and talked to us. And I don't think you realize how much that meant to those high school kids. They loved it.
Thank you for saying that, Libby. I appreciate that. You can call me anytime you want to and tell me that.
And I will tell you that my son graduated with chemical engineering. Another one's graduating from the Air Force next month, and 2 others from engineering. And so those are kids that are making an impact on our future for Texas. And
absolutely.
So my question is, I am the director at my church's Mother's Day Out preschool program. And so obviously we've been closed since mid-March. But we have an 8-week summer program that's supposed to start June 16th and run for 8 weeks. Is there a reason we cannot open? Because when these parents will see me at the store or, text me or whatever, and they're like, please tell us we're having the summer, program. And is there a reason we can't?
Well, we're watching, as I said earlier, on how long you've been on the call. I've been on more conference calls in the last 2 or 3 weeks than I have in 66 years. And one of the things Governor Abbott was saying was he wanted phase 2 to roll out in mid-May, and he's opened up a whole lot of things with some requirements, and some of those are going to be based on if there's a board involved. If it's a dentistry, there's a board. A board of dentists in Texas. If it's school, there's school boards, of course. There's a TEA, Texas Education Association. My bride of almost 44 years taught 4th grade 27 years, so I'm well acquainted with that. I think you're going to see that begin to open up, but the governor did say that, of course, they reserve the right to make some adjustments. I think mid-May, he's wanting people to be able to go back and worship in their churches in limited fashion. To still observe a little bit of social distancing. So I think those requirements, those guidelines, if you'll watch Governor Abbott, and of course we'll do more teletown halls. If you go to my website, weber.house.gov, we do updates very, very almost daily, if not 2 or 3 times a week. And so we're going to keep our fingers crossed and keep our prayers going that we absolutely can open those kinds of things up. So,
Congressman, this is Jason. I don't know if we had any other folks, Sean Miller or Blair Walsh with the Texas Division of Emergency Management, if y'all had anything to add to that. I know that's been a question on a lot of people's minds.
Well, that's a great question for Mr. Miller. I'm sure you watched the governor's call. I was trying to watch it and about 2 others. What say you, Sean? You think it's looking good for mid-June?
This is Blair. Sorry, Sean was working the tornado response, so he did not have an opportunity to be on at that time. But I will say that, I believe the governor's office is doing and taking the proper precautions and steps, and we will see what happens over the next 2 weeks. I hesitate to say a definitive yes or no, but I know that it is the governor's priority to be able to move people safely back to work and to get things reopened in a safe and methodical way. So we'll see where we get, but I believe that is the path that we are on.
Well, thank you for that, Mr. Cerna. At the Texas Workforce Commission, do y'all have any projections? I know you're paying close attention, working hand in hand with the governor. What are you thinking for mid-June? She asked specifically about June 17th, I think it was. What do you see coming down the line?
Well, we are of course deferring to the Division of Emergency Management and the medical professionals. We are certainly hoping that more of the economy is opened up and that more individuals can get back to some semblance of normality. We're going to continue, of course, to support the individuals that we're helping now as long as they need our help. But we're also looking toward a little bit of a different take on her question, but we're also looking forward to reopening the economy, working with the governor's office to do that and other state agencies in a sort of controlled fashion, but in a very expeditious fashion so we can get people back to where they prefer to be versus where they are right now.
Right. I know it's hard to make projections this far out because, as I said earlier in our discussion, this has been a very, very fluid, evolving situation. So I know you all are paying attention, doing the best you can. So thank you for that. And I appreciate you, Ms. Walsh, weighing in for us. And so, Jason, let me hand that back to you.
Well, Congressman, unfortunately, we have come to the end of our allotted time slot. It's been a great call, a lot of great questions here, and certainly we want to thank our panelists. But, Congressman, I'm going to go ahead and kick the floor to you, let you take us out here.
Well, thank you, Jason. I sure appreciate that. And let me just say to all that are on the call, y'all just, I know that many of y'all have been on some of these calls. This is a district-wide call we've had, first one we've had, and had the most people attend it. We've tried to keep up as much as we can. We've had Mr. Kumar with the SBA on with us, Blair Walsh, Section Chief, Texas Division of Emergency Management, with us, Sean Miller with us. We've had Ms. Christy Hester, the bankers with us, Mr. Cerna and Dr. Kaiser. And I just can't tell my constituents and my friends how blessed we are, number one, that we have them in our state, and number two, that they're willing to spend some of their valuable time helping us. And so thank you all to all of our guests. We really appreciate you all for being on. We appreciate all that have joined tonight and asked your question. Again, your feedback is so important to us. Weber.house.gov is my website. If your question wasn't answered, please, please, please count on us to get back to you. If you want to reach out to us for more questions and more information, we are your government representatives. If you've got a question for Social Security, or whether it's Workforce Texas, or whether whoever it might be, Social Security, VA, count on us to be your customer representatives. I want to remind you that our offices, which is your offices, I work for y'all, are fully functioning. They're fully opening. We're doing a lot of work from home. If you have any difficulty at all with any federal agency, please reach out to us. We are here for you. We love representing this coastal district of Texas. I like to say that COVID-19 will never defeat District 14. So please, please, please stay safe. And remember, we are Texas strong, and God bless you, and good night.